Well, these were highly anticipated updates, and what we got wasn't a clinical trial. It was an update on 53 patients who'd received remdesivir under what's known as compassionate use. Now, that's for very sick patients who are not included in clinical trials. And what those results showed is that 68% of the patients showed a clinical improvement, being able to receive less oxygen support, essentially. Now, there were 30 patients who were on ventilators, and the results showed that 17 of those were able to come off that intubation. But 7 patients included in these results died. Now, there are some limitations to these data. Because it's compassionate use, there are no controls. They weren't compared to anything in the study. The lead author of a New England Journal of Medicine article, Dr. Jonathan Grind from Cedars-Sinai, saying, quote, "Currently, there's no proven treatment for COVID-19. We cannot draw definitive conclusions from these data, but the observations from this group of hospitalized patients who received remdesivir are hopeful." That word hopeful is a sort of takeaway that a lot of people are taking from this update. But we are going to be looking for more controlled data from clinical trials, and Gilead outlining when we should expect to see some of those updates from Gilead's own studies. Potentially later this month, we should see an update. There was a study in China that was actually discontinued, so we're not sure when we will see those data. An NIH study is also ongoing, and that is a pretty rigorous, controlled, double-blind study. So those data will be very important to watch in May. And some already starting to speculate, including Leerink's Jeff Porges, an analyst, that we could see potential approval of remdesivir as early as May, guys. So a hopeful update, but we need more information. Back over to you.
Yeah. Hey, Meg, it's David. Just to point out here, this is infused, correct? This is not oral. This, you have to actually get an infusion to get this, correct?
That's right. So what folks are talking about is this would be for hospitalized patients who are there. And the people in this trial received a 10-day course. So you're receiving an IV drug for 10 days in the hospital.